Welcome to the Retire Happy podcast, where we learn how to get retired, stay retired, and being happy all along the way. Hello, my name is Jeremy Finger with Riverbend Wealth Management. Today I have with me Scott Stafford. He's going to talk to us about insurance for someone who is on the verge of retirement before 65 and after 65 years old, kind of in some real life examples of what some of the problems that someone may need to overcome and questions they need to ask themselves. So welcome with me, Scott Stafford. So Scott, tell me a little bit about yourself, what firm you work with, and how you help people.
Yeah, so thanks for the introduction, Jeremy. I work with the Cason Group. Our home office is based out of Columbia, South Carolina. I work in Raleigh, North Carolina. We work as an individual medical sales rep for the Cason Group. We meet with agents and brokers and advisors who meet with clients and advise them on anything under 65 or over 65, the ACA marketplace, Obamacare, famously known, or the Medicare space. And so we help and work alongside of them, our carrier partners, Aetna's, United Healthcare's of the world. It kind of becomes one nice sweet thing big pot where everybody kind of works together to make sure that clients are served and understand where they're going and their insurance needs.
Okay. All right, great. Well, I appreciate your time today. Thank you very much. Well, let's say, a lot of people are coming up, if they're trying to transition from work to retirement. All right. And then there's a gap between, if they're under 65, between how they're going to cover their insurance between retirement all the way up until 65 when they can qualify for Medicare. So can you kind of paint a little bit of a picture of like, what are some of the things that people need to ask themselves to make sure they're making the right decision on an insurance standpoint?
Yeah, well, I always tell folks it's clear as mud once you get to that age. It really is clear as mud. So it's, if you're coming of age to 65 or you're thinking about, I'm retiring at 61 or 62, and you're thinking about drawing Social Security, right? Like that becomes the conversation around age 62. Or if you're going to continue working into your mid to late 60s, there's a decision you have to make, right? So there's some decisions about Medicare. There's some decisions about, do I want to stay on my group health plan if your employer is offering healthcare? Or do I want to go into the individual marketplace? So there's three different choices, right? You have to make a decision there. One thing to note, and if you're looking into retirement, you're probably going to lose your group benefits coverage when you leave your job, right? You could have Cobra and stay on that, but we know that Cobra becomes really, really expensive really quick. So you could go into the individual marketplace, right? The ACA exchange, where you may be able to qualify for a government subsidy, where the government helps subsidize some of those health insurance premiums and the costs that you have. Now that's based on income and age, typically location, family size. So if you and your husband or you and your wife are on a plan together, usually, you take you two, your age, and how much your household income is pre-tax, and that will allow you to see if you'll qualify for any government subsidy. And sometimes that helps.
Pause right there for a second, Scott. So in other words, is that those different factors, who's in your household, how much income you make, determine if you have some government subsidies that would help offset some of the cost with health insurance. Is that right? You kind of help determine what that amount is for people?
Yeah, so the government has a formula, again, clear as mud on the formula. It usually takes into account the lowest costing silver, and they multiply that by 10% of your income, call that, and then that's your monthly premium. So if it's less than that number, then it's deemed unaffordable, which means you may then qualify for a government subsidy. So household income is typically how they base that. And so obviously the more money that you make in an income, the less subsidy you qualify for. But the older you get, the more likely chance are you would qualify for subsidy regardless.
Okay. Now, do you find that people who are, let's say, 64 are able to qualify for it easier than someone who's maybe 61? Is that the deal?
It's a formula, but but some of those folks just need, right? You just need a gap. Like if you're 64, you just need a year of insurance, right? So there's several different options where you can, if you're like, I don't want to pay for a huge healthcare plan, I'm fairly healthy. There's short-term plan options. United Healthcare is pretty great at having some short-term options that we use specifically. And individually marketplace, again, it's a formula that the government uses. So there's no real difference for a 61-year-old to a 64-year-old on what you could qualify for.
Okay. All right. So like in my world, like when someone is trying to transition from working to retired and they're trying to do that before age 65, right? Bridging that gap to Medicare, we try to build in health insurance cost. And so you have helped some of my clients come to determination of what that insurance cost is. And then we model that in as far as income is concerned. But you did mention that have you seen instances where Cobra makes sense? And just to kind of let you know, guys who are listening, that Cobra is usually an 18-month extension of your work's insurance benefit. And you mentioned that it can jack up as far as the expenses are concerned on Cobra insurance for your employer for 18 months. And then you use that cost compared to some of the things that you come up with. Scott, is that the deal?
So somebody's transitioning out of their role, right? So we're saying, whenever I talk to someone or advise a client, I say, hey, do you know what your Cobra cost is? A lot of people don't know that their employer is subsidizing most of their health benefit, right? Like your employer is covering a lot of your health premium a month. And so when you leave, they give you the Cobra, the same plan you've had with your employer, except they're no longer paying on it. So that $100 a month premium that you had that you were paying now becomes $800 or $900 a month. And people are shocked by that, right? You get shocked when you see that initially. I know I did when I moved jobs. What you don't know is you have the option to also go into the individual marketplace. And so what we do is we compare, let's look at your Cobra plan. Let's look at the individual marketplace. What do you prefer? Do you like co-pays, which on an insurance plan basically says when you walk into a doctor's office, this is how much you will pay every time. Do you prefer a health savings account, an HSA, which typically draws a higher deductible that allows you to contribute into that account for tax deferred? So any medical expenses that you incur on that plan, you can use money out of that account to pay for medical expenses. So we do a little bit of comparison between those two things, right? And most of the time, folks really like what they had with their employer. So they either tend to go there, or we try to find something comparable to what they did have on Cobra for a cheaper cost for them on the individual marketplace.
Okay. Well, what are some of the mistakes do you see people make when going from work to retirement and trying to navigate this insurance obstacle?
One of the primary ones, and I asked our team about this, and I was like, hey, what do you think the number one mistake is? And this one it's not that surprising to us, but it surprises a lot of people that we talk to, is that people tend to focus on the deductible for a plan rather than the maximum out of pocket. So when you look at your health plan, if you were to look at the deductible, some plans have a $1,500 deductible, some have a $3,000 deductible, and people see that and they get drawn to it, right? They're like, oh, I know if I hit my deductible, benefits start kicking in. What they fail to see is the maximum out of pocket, which $8,700 for a family, it can creep into $15,000, $17,000, which basically means once you hit your deductible, you're going to have some benefits kick in, but you still have to pay a co-insurance or things like that until you hit your maximum out of pocket. Now, once you hit your maximum out of pocket, your insurance plan starts covering 100%. So that is where people tend to get caught up on the deductible. And now sometimes it is good to have a deductible that's low or that you desire. You're healthy and you're younger, or you're looking toward retirement, you have no health issues. An HSA plan, a high deductible plan, sometimes can be the best option that allows you to contribute into an HSA to help offset that cost of a maximum out of pocket.
Okay. All right. That's a very good point. And I'm going to translate back what I heard. When people sit there and say, well, oh, I met my deductible, you're not home free yet. You still got to pay some money. It may be less than what you've paid before. You're going to have to keep paying money until your maximum out of pocket expenses hit. And then you're home free. That makes a lot of sense. And you did say another good point is, so if someone's healthy, maybe a high deductible plan might make some more sense. I've talked a little bit, actually a lot, and written some articles about the benefits of HSA accounts. Tax deduction going in, grows tax-free, comes out tax-free for qualified expenses. And that's very, very good for retirees. Very, very good.
It also, to kind of tack onto that, it's free, or you can use it for any medical expenses. However, if you get into a pinch and you need to pull money from it to use to repair a house or things like that, you can pull it out. It functions similarly to an IRA or something like that. There's like a 30% penalty. But again, if you're not using it for that medical expenses and your roof blows off of your house or something, you've got some money sitting there you could use if you needed to.
Yeah, 100% the case. And here's the thing is like, let's say, for instance, that they paid a medical expense in the past. There's no expiration date on the medical expense. So if they have an HSA account today and they need to take money out, but they had paid from a medical expense, 10 years ago, they can take the money out to offset the expense they incurred 10 years ago. So there's a variety of different ways that they can, take that money out tax-free.
And it also carries over into Medicare.
So. Right. That's right. The confusion around what deductible is versus maximum out of pocket, is the distinction where a lot of people make mistakes. Anything else top of mind that people make mistakes on?
I mean, I've got a ton of Medicare questions, like a ton of Medicare mistakes, things that folks wonder about, think about.
Okay.
So if you want us to transition into the Medicare from the under 65, we can do it.
Let's fire away.
Perfect. There's plenty of things that Medicare is a very stable market, but there's not a lot of clarity on what to do, how to do it, what does it cost to me, do I have to pay for these things? And so a little bit of info on Medicare just to help kind of set the foundation for folks that are wondering about, I'm getting ready to turn 65. What is Part A? What is Part B? The best way to remember it, Part A is an inpatient part of the Medicare world. So anything in the hospital is the best way to memorize that. You're in the hospital, typically Part A is going to cover that. Now there's some nuanced things, that Part B will cover in the hospital, but Part A for the most part covers things that happen in the hospital.
Okay.
There is no deductible or premium for Part A. People think it's free. That's a misconception. You pay for it while you work. That little bit of paycheck that comes out every month that goes to Medicare and FICA and all that stuff. You basically paid for your service when you turn 65 while you work for the last 30 or 40 years. Part B is the outpatient piece of Medicare. And that covers, again, outpatient services, anything done outside of the hospital, doctor's visits, things like that. That typically covers it. There is a premium for that, and there is a deductible for that. The premium, let me look and make sure I got my 2022 notes right. It's going to be $170 a month this year in 2022. That's a 30% increase from last year. We just found out there's a drug, and I can't remember the name of it off the top of my head, but there's a drug that made the increase in Medicare Part B go up, and I can't remember the name.
Is that the Alzheimer's drugs?
Oh gosh, I can't remember the name of it. I can't remember.
It's okay, but does it treat Alzheimer? Do you recall? The main thing is that Part B expense is going up by 30% to what, $170? Is that
$170, and that's a monthly payment.
Okay.
And then the deductible for your Part B is $233. And that's an annual deductible, not monthly. That's an annual deductible. So once you hit that $233 for the year, your benefits start kicking in on the Medicare Part B.
Okay.
So a fun thing about the enrollment process of Medicare, this is where folks get tripped up. If I'm honest, people get tripped up here because you can start taking Social Security at 62, right? And so you can choose to accept to start taking Social Security or not at 62. You can defer that out. If you start taking it at 62, you automatically get enrolled in Part A and Part B at 65. So you automatically start receiving benefits for that at 65 if you're taking Social Security. Okay. Now, if you don't take Social Security, you have to enroll in Medicare Part A and Part B. You have to do that manually. Now, you would think you'd have to do that at the Medicare website, right? Medicare.gov. You don't. You do that at the Social Security website. And so it makes, again, perfect sense. And that was something made long ago when Medicare started in 1965. And you have to go to the Social Security website to do that. So the best way to remember, if you're receiving Social Security at 62, you're going to automatically be enrolled at 65. If you are not receiving Social Security, you'll have to do that manually on the Social Services website.
Okay. All right, perfect. Pause there for a second for anybody who's listening or watching. To maximize Social Security, you don't take it at 62 unless you know really when you're going to die. And most people don't know that. So, but let's assume for a second that someone's not taking Social Security. They're working with their financial advisor to try to maximize their benefit in Social Security. I turned 65 sometime within the year or in mid-year. when do I need to start thinking about and having a conversation with your company or somebody else for that matter to make the best decision on knowing what to do with Medicare?
The great news is there's a 7-month window that you
Okay.
have to decide. So if you're turning 65, say in March, you've got the 3 months before that. You've
Okay.
got the month of your birthday, and you have the 3 months after that. So you have 7 months to enroll in Medicare or prove to them. You can delay Medicare Part B if you can prove to Medicare that you have what is called creditable coverage, meaning that your coverage on your employer or what you currently have is as good or better than Medicare.
Okay, perfect.
I should also add in there, if you don't enroll in Part B, you can face a penalty or a fine of 10% premium increase. So you're looking at this year's at $233, $170 a month. You're looking at a $17 tack on if you don't enroll during that enrollment period or don't show Medicare that you have creditable coverage. And that will last for the duration that you have Medicare Part B.
Which is for the rest of my life?
Could be 20 years. Yeah, could be as long as you're living.
So as long as you live, so lifetime penalty. Okay, ouch.
Yeah, ouch. It surprises a lot of people because they're like, I thought I had it with my employer, but you just have to prove that to Medicare and show them that you have coverage if you're still working and don't want the Medicare benefits at 60.
So how would they go about proving it? Like, okay, let's say I'm working at 65 and I'm not working with a financial advisor that's making sure that these dates are notified to the client. How would I go about notifying and making sure that I'm not getting a lifetime penalty?
So there's 2 different options to do that. If you turn 62, it's really simple. When you turn 62 and if you're receiving Social Security, they're going to send you those cards regardless when you turn 65. All you have to do is send the Medicare Part B card back. And it's kind of like they get the hint, right? Like I'm still working.
But if you're not taking Social Security and retired, or if you're not taking Social Security and working, what happens then?
If you're working, you're going to need to go to, typically what we've seen in the past is an employee will go to HR or someone and they can have a letter drafted from HR on the company letterhead that kind of shows their coverage and outlines their coverage. And then they can send that into Medicare, the CMS, Center for Medicare Services, and that will show. And then they'll kind of come back and say, like, okay, you're excused from any of the Medicare Part B penalties or things like that.
Okay. All right. Perfect. Okay. So you go to your HR. All right. Let's say you're retired. All right. You're not taking Social Security yet. You're living off of your savings and whatnot. What do we do then?
That's a great question. So if you're living off savings and you don't want Medicare Part B,
well, hang on. Let's say you do want Medicare Part B. So I know let's just say I'm turning 65 this year, or excuse me, next year, and we need to be in this 7-month window. What do we need to do? Like, how do I need to think about this?
If you're getting ready to turn 65 in that window, one, I would always talk to an agent. I would always go talk to someone local, talk to us. Typically, we will refer to an agent in the enrollment process of Part B because we work more on the Medicare supplement, which we can get into later as well, and the Medicare Part D plans, prescription drug. So I would always say go and talk to an agent, a local one. Don't call the number on the TV that you see at lunchtime. Don't Joe Namath, all those guys, it's a whole different conversation, but go talk to someone local, let them advise you on what is the best thing to do for Part B. For me, I would say if you're drawing on retirement, things like that, there's really no reason not to go ahead and do Part B. It's cheaper. You're going to have nationwide coverage. So if you travel, you're always going to have a doctor somewhere that's going to have that accepts Medicare.
Okay. So when you say local, though, you cover like North Carolina, South Carolina, right?
Yeah, they could call us and talk about Medicare. We would our process is we would just advise them to go, hey, here's a few resources that we have handy, and then advise them to go to the Social Security website and go enroll. And obviously, we work with local agents in basically across the Southeast, Myrtle Beach. Anyway, you look and we've got an agent that we work with or partner with.
Charlotte, Raleigh,
Durham, Columbia, Greenville, Spartanburg, Atlanta, Richmond, Knoxville, Nashville, you name it. Southeast, you think about it, we've got a footprint there, and we've got agents that work right there in your backyard.
All right. You walk someone through to being able to make sure that they get their Medicare Part B coverage, right? And then, it's usually less expensive, like you say. You avoid the penalty, like you say. And then what else? Okay, so am I home free now? Is there anything else a retiree would need to think about?
Yeah, so Medicare, original Medicare, as it's called, doesn't cover dental, doesn't cover vision, and doesn't cover any hearing. And people have asked for years, why hasn't Congress or anybody gone back and kind of retroactively added that stuff in? We've been asking it for 50 years, and I bet we'll keep asking it in terms of what Congress will do and how it'll change. And so there's some supplemental plans, right? We know that Medicare, original Medicare, doesn't cover everything. You can come to the Casing Group. We can help you find out dental, vision. We can also help you get enrolled in a Medicare supplement and a prescription drug plan. You have to have a prescription drug plan that's kind of functions similarly as a Part B, or you have to be able to provide proof that you have coverage that is better than a Part D plan in order to not face a penalty on that one as well. There's a 1% penalty for each 12 months that you don't enroll a Part D plan.
Okay, so can you kind of repeat that again? Because you said it doesn't cover dental, it doesn't cover hearing, it doesn't cover vision. And then you went on to talk about like a supplement. Does the supplement cover those three things? Does it cover those three things? A supplement?
It doesn't. So a supplement plan, the best way to think about it is on paper, you can call it a Medigap policy or a Medicare supplement policy. It essentially fills in gaps where Medicare doesn't cover things, right? So it'll help fill in, like a Medicare supplement plan would help fill in the deductible on a Part B. So,
Okay.
you look at that, some of the plans, there's 10 of them that the government has allowed private insurances to sell, and they're A, B, C, D, E, F, G, H, all the way up to N. G and N are typically the most popular, and they have the best blend of coverage, kind of bang for your buck.
Okay.
Plan F was very popular for a long time, and the government discontinued that, I think in 2020, maybe 2019. If you are over 67, I think you can still kind of grandfather in.
But does any one of these cover what does that cover though? I mean, it doesn't cover the dental, the vision, or the hearing, or it does?
Right. So it goes in, it doesn't cover that.
It doesn't cover that. Okay. All right. So
Yeah.
what does this gap coverage, this Medicare gap coverage do?
So any expenses that Medicare doesn't cover, I mean, there's first 3 pints of blood. Like, there's all kinds it's very nuanced. So we can get into the weeds on it.
All right.
Yeah.
All right.
The main one to think about is the Medicare Part B deductible. It helps offset that $233 and keep people from having to hit that deductible. It hits it for them, so they start receiving benefits from Medicare Part B.
Okay, perfect. So let's say I got gap coverage, all right, because there's some nuances with Part B it doesn't cover, all right. Am I home free? It doesn't sound like I'm home free yet. Okay, all right, so take me through the yet part.
So you got, again, clear as mud. Part D is the easy to remember. Part D, drug coverage. Part D helps on prescription drugs. So if you are taking prescriptions or things like that, a mistake people usually make is they don't check any PDP plans, that's what we call them, to see if their drug is actually covered. They just see a cost, a premium, and they're like, oh, I'll pay that. And they never actually check to make sure that their prescriptions are covered or that their pharmacy is in network or things like that.
So they choose a Part D coverage, but they don't choose the coverage that covers their drug or their pharmacy. That's a mistake that people make.
Yeah.
Okay.
We've seen, and obviously going to different pharmacies changes the cost of drugs and things like that too. And so you want to have a Part D. If you're on original Medicare, you want to have a Part D plan. Because you're going to be taking medications. Once you hit that age, you start taking more medications, and you want to make sure that that stuff is covered. And those plans range anywhere from $8 a month up to $70 a month. And that's just a rough ballpark number in terms of what it hits and what it covers.
Okay, perfect. Okay. So I've got Part D. Am I home free yet?
You are home free. I must also mention that the Medicare supplement, don't have to have it. It is very optional. And in my world, we always recommend the Medicare supplement because it does, if you're on a fixed income, does help offset some of those costs.
Okay, perfect. Now, the D covers the drugs, but what about my hearing, my vision, and my dental?
There are standalone dental plans and standalone vision plans on the private marketplace that you can go to.
What about hearing too, or you just I got to go out of pocket for that?
So I've heard tell, I don't know where to find these, but they are these things called DVHs, dental, vision, and hearing plans that kind of encompass everything all together to have in addition to your Medicare policy, your Medicare plan. So I don't know. I don't think that we sell any of them, but there are options out there to find that coverage at a fairly inexpensive price.
Okay. So to kind of recap here is like A is everybody gets A. The B, there is some premium there. You got to make sure you don't have a penalty. And then D, no, you got a Medigap, which makes B covers more bases within the B. And then D for drugs, that covered making sure that your pharmacy is covered and then your drugs are covered with whatever you choose there. Once you have that, you got a lot of bases covered. Is that right?
Yep.
All right, perfect.
Yep.
Now, outside of that, it still leaves hearing, vision, and dental. And those costs can be covered with some types of insurance that are unique. But at least from what I have found, with some of my clients, I see sometimes a $2,000, $3,000, $4,000, $5,000 withdrawal with special hearing aids or whatever, and they have to pay that out of pocket. Now, I model in with my clients, and I certainly advise it to other people that model in some healthcare costs over and above the premiums you pay for types of things like that. But so they have to go really that you kind of got to make sure that you budget in, either get special insurance for the hearing and visual and dental outside of these other coverages. Is that right?
Mm-hmm. Or this brings us to this is a wonderful transition into the next topic.
Okay.
Or you go into Medicare Advantage.
Okay.
So there's original Medicare, then there's Medicare Advantage. Again, the difference between that, original Medicare is from the government. Medicare Advantage is a private insurance plan. So think of an Aetna, a Humana, a United Healthcare, AARP, someone like that. They have Medicare Advantage plans that you can use. And those typically do encompass hearing, dental, vision, prescription drug. They kind of take all the things you have from Medicare and encompass it into one plan.
Oh, okay. So like at 65, let's say, when in that 7-month window, when I'm trying to do A, B, D, and all that, there is it, and I don't have the dental and the vision and the hearing. Advantage plans lump all of that together.
Right.
Okay.
Right. So most of them do. I can't say all of them because all of them don't, but some of them do. Yeah. And so you can choose to decline Medicare altogether and enroll in a Medicare Advantage plan. Again, Joe Namath on TV, right? They call the Medicare hotline. They're typically selling a Medicare Advantage plan, and not always the best plan to have. Like, those plans are typically, what you see is they deliver food to your house and they, build wheelchair ramps for you and all this. So there's all these like perks that they market, right? And the government actually did away with being able to like sell those to folks over 65 outright because people were buying them without knowing what they were getting. So now there's a scope of appointment form that agents typically have to get clients to sign before they can discuss Medicare Advantage and prescription drug plans. And in the 90s and the early 80s, people were just signing clients up for Medicare Advantage plans without ever consulting them or making sure they understood what they were doing. Because sometimes there's I think it's a 6-month or 12-month window. I'll have to check my fact on that. That's a look back window. But once you kind of go to Medicare Advantage and you go through it, you can't go back. You can't just go if you have like a look back window where you're like, I didn't actually like this plan. I want to just go back to original Medicare. There's a window of opportunity for you to like kind of dive into the water and see if you like it. And if you don't, you can go back to Medicare. But if you stay in it for over a year, I think it's a year, I'll have to check my fact on that, you're there for good.
So is this a permanent decision from then on out?
And so I would always advise calling your local agent against calling that 1-800 number. If you ask local agents around the area, they would say that's the biggest competition they have, simply because it's on TV at lunchtime or it's on TV at 4 o'clock or thing right before the news.
Okay. So what's the big advantage of calling someone local versus that 800 number?
You get to sit face to face with somebody and you get to understand. It's a personal relationship, right? I've always think of insurance as a personal relationship. We're talking
Okay.
about health. We're talking about life insurance. We're managing people's money. It's a personal relationship.
Yeah.
You call that 800 number, it's probably somebody in Missouri or somewhere that's going to just try to enroll you in a plan, and you'll never talk to them again.
Okay. So in other words, they may get to understand your situation a lot better if you're dealing with someone, more on a personal level than it would be some call center try to make numbers and whatever, and may not do the right thing for you.
Right. And that's what we have seen. We've seen people call us in the past and I'm like, I got suckered into this 1-800 Medicare hotline and they signed me up for this plan that I didn't even know I wanted. And so it's an interesting thing. So I always tell folks, somebody local, go talk to them.
Gosh, what's crazy is that, with most investments, you at least have a period of time where you can get out of them. But if you make a mistake on Medicare Part B or these Medicare Advantage plans, it's a lifetime penalty. I mean, if you're outside the window, if you make a bad decision, you're there until you die. Is that right?
Yeah. I mean, the Part B, the increase in penalty. Yeah.
Yeah. Wow. Okay.
And there's some things you can do to change those, but it's rarity that happens.
Okay.
And so again, talking to somebody you can sit across from face to face that's knowledgeable and knows and is accurate, that's where you want to go.
But here's the thing. Although y'all may have a telephone number where, and you get somebody in Columbia. If I'm sitting in Knoxville, Tennessee, or Raleigh, North Carolina, or Charlotte, or Savannah, Georgia, or Charleston, you're going to end up putting me with somebody where I can actually sit with somebody and chat with them and understand my problems, and to where they can guide me into making sure I'm covered with A and B and D. And then if an Medicare Advantage plan might make the most sense or not.
Yeah. So yeah, similar to what you and I do, you have clients that you've sent to us in the past 6 months or so.
Right.
We, in my opinion, we're an extension of you, right? Like I'm an extension of the local agent. Whenever somebody calls into our number, you're always going to talk to one of our folks. And if something were to go wrong or you've got questions, you're also going to your local agent. You're going to them and asking them questions. And then you're going to call me and say, well, where's this happening? Where the heck did this go? So
that's right.
We're an extension of what you're doing.
I get you. And guess what I do? I still ask those clients, I'm like, how are they doing? They doing okay? Because I want to hear if they complain. But
I do too.
Everything's been good thus far. For me as a financial advisor, what I see that you guys are is, I do see you as an extension of me with an expertise in the area of healthcare, pre-65 and post-65. So making sure that the client is taken care of and avoids any lifetime penalties and things like that, and to make sure that the coverage that they need is accounted for. Now, y'all's responsibility and the client's responsibility back to me is to get an idea of what that cost is, and I model that in and make sure that the clients are taken care of, both the bridging the gap to Medicare, and then accounting for the health insurance cost post 65 too. So that's where we really have been able to work well together.
Yeah, it's been a good thing, and I hope it continues. And we will always do what's in the best interest of the client. That's what we'll always do, and the Casing Group has built a reputation on doing that and doing what's best for our agents and doing what's best for the people they refer to us.
Perfect. Yeah, and that's what I found out too. At least. Any final thoughts? Anything else top of mind, like that someone who is listening to this or watching this, like how would they get in contact with you, or anything else top of mind that we didn't cover that you want to mention?
Yeah, so if you want to, you've got my email address is Scott Stafford at thecasinggroup.com. Phone number, it's 803-252-3033, and I can confirm that with my phone. Don't know where it is.
Scott, don't worry about it, brother. I'll put it in the show notes for everybody, and I'll make sure everybody can get in contact.
Yeah, come blow me up. Yeah, blow up my inbox. It's already a disaster anyway. So,
right. If someone is reaching out, I'm going to make sure that you have the right telephone number and the right email address, so that there's a lot of volume that's inbound, that your team is able to help facilitate anybody making those inbound inquiries. Okay.
Yeah, that's right.
I'll make sure on the show notes version of the contact information that is sort of the right people. Okay.
Yeah. Yeah.
All right,
And
so
the
that's
last thing I'll add into this, unless you've got some other stuff you want to talk about, is one of the questions that you prompted me to ask was how often do retirees need to look at and assess their insurance?
okay, good.
That was one of the questions you had sent. I was like, this is probably worthway.
Sometimes
Every
I
year.
forget. Sometimes I forget all the good things I do.
Yeah, I forget. The only ideas you have are good ones, and so
Yeah, well, that's right. Hey, we'll edit the ones out that are not.
That's right. But folks should review their insurance every year. There's an open enrollment period every year for Medicare that basically runs October 15th to today, December 7th, for the ACA under 65 market, November 1st through typically December 15th in the past. This year it's been extended to January 15th.
Okay. And they review it like making sure that the coverage is matching up with what their needs are. Is that how you guys do that?
Yeah, typically I would tell folks, hey, each year when you get to open enrollment, review your expenses. Did you use all of your health insurance? Did you hit your deductible? If you didn't hit your deductible, is it worth lowering it? Is it worth going higher and having a health savings account if you're not going to use it? And so it's always a chance to review it, get feedback on it. Well, this plan didn't cover this, and I ended up using it a lot this year. We can help you find options that maybe fit the bill for you in the year to come.
And you got staff that is able to handle that kind of inflow, because I know y'all got to be jammed up with people if you have just a window of time that can happen.
Yeah. It's fourth quarter is a very busy season in this. And so we field every call and try to make sure everyone, the best way to do it, we usually schedule an appointment and they call in. It's a 20-minute conversation. We typically send them a quote or two that says, hey, if you wanted to change, here are some other options that are comparable or maybe better than what you have. And if you want to stay the same, we'll renew it for you.
Okay.
No harm to phone.
Okay. All right. Good points. All right. So kind of from my standpoint is that when I'm looking at someone who is trying to get retired and stay retired, their insurance is one of the key hurdles that people have to deal with. Okay. On the healthcare side, of course, life insurance is part of it, but most retirees, they're looking at trying to get retired and stay retired, and then whatever's left goes to the kids. You guys and some of the other people that I work with are really do a great job at help guiding a retiree to and through all the complex decisions that need to be made to make sure they're not making big mistakes. And in some instances, there are lifetime penalties involved if they don't make the right decision. So good. Anything else to add to this?
No, I think we've just solved all of the world's issues.
I think we did. Just in time for the new year.
Just in time for Christmas and the new year.
That's
we're good
right.
to go.
All right. So Scott, thank you very, very much for your time. And I appreciate your service that you've had for the people that I've sent your way. But again, if you want to get in touch with Scott and his team at the Cason Group, check the show notes. And if you get any questions at all, certainly feel free to give me a call or send me an email. Again, the contact information is in the show notes. So thank you very much and have a great day.
Investment advice offered through Stratos Wealth Advisors, LLC, a registered investment advisor doing business as Riverbend Wealth Management. The opinions voiced in this podcast are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which strategies or investments may be suitable for you, consult the appropriate qualified professional prior to making a decision.